We're live on Facebook.
Good morning, and thank you for joining us this morning. I'm Loretta Alexander, Health Policy Director at Arkansas Advocacy for Children and Families. We are excited to have you here join us here today for this Arkansas Kids Count Coalition panel discussion focused on COVID-19 and the Hispanic Latino community in Arkansas. The Kids Count Coalition is the sponsor of this event today, and we're excited to have you all here to witness our panel discussion. If you are not a member of the Kids Count Coalition, which is a membership group of individuals and organizations from all across the state who are dedicated to raising awareness about policy issues impacting children and families and teaching people how to lobby and advocate, we welcome you to join our coalition. And you can contact Rebecca after the end of this session if you're interested. Today, we will be discussing the impact of COVID-19 on Hispanic, Latino Arkansans and lessons learned from outreach that can help with future public health outreach efforts. We have some prepared questions for the panel. We will also be taking your questions at the end of the event, so please ask them in the Q&A feature at the bottom of your screen. We also have closed captioning available by clicking the live transcription option at the bottom of your screen. We will share a Spanish caption version of this forum by March 22nd. So now I'm going to introduce our panelists. We're happy to be joined by a panel of health experts and community leaders. Maricella Garcia, Race Equity Director for Advocacy at Arkansas Advocacy for Children and Families. Dr. Eddie Ochoa, Section Chief of Community Pediatrics for UAMS. Dr. Jose Romero, Secretary of Health, Arkansas Department of Health. And Dr. Joel Tomlinson, Physician in Outbreak Response, Arkansas Department of Health. Dr. Romero, our first question is for you. Dr. Romero is the Secretary of Health at the Arkansas Department of Health. And what we would like to ask you, let me turn my sound up so everybody can hear me okay. Sorry about that. Is my sound better now? Can you hear anybody? So Dr. Romero, as I was asking the question, what is the overall impact that you think COVID has had on our state so far?
So thank you very much for inviting me. And, thank you for allowing me to share this webinar with such a distinguished panel. You know, we've had, I think, a significant impact of COVID on our state. We've had significant number of hospitalizations, and in the last two major surges, that is the Delta and the Omicron surges, you know, we've really taxed the healthcare system and come quite close. And I think it's one of the few things that have kept me up at night during this pandemic, during the 2 years of this pandemic, is that I was afraid we were going to have to enter crisis standards of care, where we would have to ration care for lack of beds. Thankfully, through use of funding that's available to us and through the legislature to approve that funding, we were able to expand beds and to meet that capacity. But each time we've come very, very close, and each time we've come closer, it makes me very concerned because there are vulnerable populations and population in general of the state where we could prevent these types of hospitalizations that we're seeing. So I think we've been taxed by this. I think also the number of deaths that we have in our state are quite high. You know, we're seeing anywhere from 30 to 40 deaths a day. You know, if the number of cases that we've seen for deaths have exceeded 10,000, which if to put it in an easier way to understand it, that would be as if 747 crashed in our state each month during the pandemic. That's how many people we're losing each month. It's more than we lost during the great influenza of 1918. Keep in mind that we now have vaccines to prevent that. So, you know, I think it's important. I think going forward, the COVID pandemic will have an impact on healthcare in the future, long after this is gone, because of the long-term complications of COVID. And we have yet to begin to understand that. That's long COVID, individuals that have cardiovascular disease from it, the association now of COVID with diabetes in children and in adults will come forward. We now have a recent report showing that long-term cardiovascular complications of this disease are going to be significant. So this is going to be an economic and healthcare burden to our state going forward. Thank you for that, allowing me to make those opening comments.
You're welcome. Now our next question is to Dr. Tomlinson. Relative to the size of the Hispanic Latino population here in Arkansas, what have been the differences in the rates of testing, infections, deaths, and vaccinations between the Hispanic Latino community and other populations here in Arkansas?
Yeah, thanks for having me as well. Let me just try to share some slides. Hopefully there's not too much information on the slides. I tried to keep each one not too busy, but I think it'll help for points of comparison as we're talking about this. So let me see if I can get that pulled up. I believe y'all are seeing my my slides now. Is that right? It says Hispanic, Latino Arkansans, and COVID-19. All right. Yeah. So you can see the caveat down there. These are data from a couple of days ago or earlier, and realize that with all our data, the data keeps coming in, so numbers get adjusted. My bosses insist that I tell you that. So to move on to the first thing, just as a baseline, these are population estimates in the state of Arkansas from the census in 2020. So the total Arkansas population, a little over 3 million. The proportion of that Hispanics or Latinos make up was estimated at 8.02%, almost 245,000 people. But that kind of gives you a baseline for these other comparisons we're going to make. The Hispanic population was estimated at roughly 8% of Arkansas's population. Now, many of you may know this more than I do and better than I do. Some say that's an underestimate, just because our census data is only as good as those who actually get counted in the census. And you'll see that kind of issue come up in the rest of our data as well. That leaves the non-Hispanic population in Arkansas roughly 92%. All right. As far as the deaths in Arkansas due to COVID-19, we've had, as Dr. Romero mentioned, over 10,000 deaths so far in the pandemic, which is a lot of people. Among those, 362 were Hispanic or Latino individuals. I guess I should say that were identified as Hispanic or Latino individuals. That makes up 3.51% of the total number of people who have died of COVID-19 in the state of Arkansas. Now that's less, obviously, than 8%. 9,460 were among non-Hispanics. However, you can see that 467 people who died, their ethnicity or race is unknown on their death certificate. For whatever reason, it wasn't entered. Either the person who was filling it out didn't know, or they just didn't bother to fill it out. That complicates our data a little bit. But of the ones we know, 3.51% of those who have died in Arkansas due to COVID-19 have been Hispanic individuals. Now on to hospitalizations. A similar look. In Arkansas, there have been 35,686 people hospitalized due to COVID. That's how many have had a bad enough case that they had to be in the hospital. Of those, 2,015 have been Hispanic individuals. That's 5.65% of the total number of hospitalizations, leaving 32,346 who were non-Hispanics, yet still 1,325 who we don't know the ethnicity or race on. So 5.65% of those hospitalized have been Latinos. Then if you get farther out into positive cases, those diagnosed with COVID-19 that have been reported to the Arkansas Department of Health. Overall in Arkansas, it's well over almost 817,000 people so far. Of those who were recorded having Hispanic or Latino ethnicity, 63,247 for 7.74% of the total cases. That's roughly the same percentage of the proportion of the population in Arkansas made up by Hispanic individuals. And then you can see the other numbers here. Remarkably, look, 112,000 people, when their report came into us, it was not recorded what their ethnicity or race was. I mean, that not only affects our thinking about Hispanic Latino individuals, it affects our looks at the data for everyone else as well, making it difficult. All right, this is a graph to show you kind of the age breakdown among Hispanic individuals of all cases in Arkansas through the age group. I want you to look at the yellow bars, just kind of ignore the blue bar. The blue bar was this was comparing between two meetings we had over time, but look at the yellow bars. And that kind of gives you the breakdown. You can see that the highest number of cases in Hispanics was amongst 25 to 34. Unless I'm mistaken, that skews a little bit younger than the population in Arkansas as a whole, but it's not too dissimilar. Notice that among Hispanic individuals, the number of cases in those 65 and older is actually fairly low. That is lower than what that would be in Arkansas as a whole. However, that may be due to the Hispanic population skewing younger, those Hispanics living in Arkansas, than the population of Arkansas as a whole. But what I do want you to notice is that these rates of cases among Hispanic children in Arkansas, you see 0 to 10 or up 11 to 17, those are not drastically higher than in the Arkansas population of the whole, but relatively higher. So fewer in the older population, more in the younger population. Maybe that is also due to the population of Latinos in Arkansas skewing younger than the population as a whole. Now on to vaccinations. This is a graph that you might have seen on the governor's press conference frequently that looks at the portion of Arkansas residents 5 and older, right? They're the only ones we can vaccinate up until now. Of all those that age or older, what proportion have been vaccinated, fully vaccinated, or partially vaccinated by race? This pink bar is for Hispanic individuals. And you see that in both of those bars, Hispanic individuals, per our data, in Arkansas are getting vaccinated at higher rates than the population as a whole. So I would say that's good news. To give you an idea amongst children, because it was listed that was an interest, in those, so all of these are in stats for individuals less than 18-year-olds. We have 2 erstwhile pediatricians on our group here and a number of others who work closely with children. So I hope this information is helpful. Amongst those less than 18 years old, the population estimate, so these are just in total numbers in Arkansas, we've got almost 700,000 people living in Arkansas that are less than 18 years old. That number amongst Hispanics is 89,607. So that's 12.81% of the total population, the total of those less than 18 years old in Arkansas. So of all those 17 and younger in Arkansas, 12.81% of them are Latinos. And then you can see the corresponding proportion in those who are not Latino. For comparison in deaths, fortunately in Arkansas, we've only had 8 deaths in that age group, those less than 18 years old. Amongst Hispanics, we've not had any that we know are Latino. 6 among non-Hispanics, and those unknown, there are 2 deaths where it wasn't recorded. So that's maybe the good news in all these horrible statistics that we've been going through. As far as hospitalizations in those less than 18-year-old, you can see here, there have been 1,300 plus, 1,360 plus hospitalizations of children in Arkansas. So it's often the effect of, you hear lots of arguments about things about we shouldn't be doing all this stuff because it's not affecting children. What's the big deal for kids? Well, 1,300 kids, 1,360 kids in Arkansas hospitalized due to COVID-19, which is supposedly benign for children, is not an insignificant number. Obviously, it's not nearly as bad as in the adults, but it's still a significant number. And of those, 189 were identified as Hispanic. That is 13.88% of the hospitalizations in those 18 and young, less than 18 years old. So that's actually a higher percentage compared to the population than we've seen so far in any of these statistics. And then among cases, cases in those less than 18 years old, there have been 178,000, so almost 180,000 kids in Arkansas have been diagnosed with COVID per our numbers during this pandemic. And you can see 18,442 identified as Latino. That's 10.35% of those cases in all children that have been diagnosed in Arkansas. So I hope that gives you a little bit of background and kind of points of comparison for how COVID-19 has affected Latinos in Arkansas.
Thank you, Dr. Tomlinson. Now to Dr. Ochoa. Dr. Ochoa, as a pediatrician, what are parents asking about COVID, testing, vaccinations, and concerns? Are their concerns any different with regard to other races and ethnicities?
Well, thank you, Loretta. Thanks for inviting me to this panel, and good morning to the distinguished panelists as well. I think those are very good questions. I do want to make a quick comment about Dr. Tomlinson's slides, in that, it's interesting. I think all of us on the panel, and probably a lot of you on this Zoom, know that the Hispanic population in Arkansas is historically undercounted. I go back to the opening of the Mexican consulate in Little Rock in 2007, when at the time the government said they wanted to open a consulate here because they knew there were lots of Mexicans living in Arkansas, and they estimated that there were about 150,000. So on Dr. Tomlinson's slide, it's probably unlikely that there are 250,000 Latinos in Arkansas right now. I mean, there are probably 300,000 to 500,000 just Mexicans in Arkansas right now. So, we're talking about big undercounts here. So that will spill over to what we know about hospitalizations and positive cases and all of the rest. So I just wanted to throw that out there. I think from the beginning, I mean, the earliest days of the pandemic, we had parents asking us in clinic, what was going on with COVID, and it's continued to this day. And as you mentioned, it ranges from the disease to testing to immunization. I think as a group of providers in our clinic, we were very conscious of what we were hearing at the beginning in the news, that in the big cities, really people of color were the ones that were bearing the brunt of this illness. And so we were very cognizant of the fact that our catchment population was going to be at higher risk than anybody else. And, I think based on that, we were ready in some respects to answer the questions that people had, but we were also the beneficiaries of a relationship that we had built with people over time. And again, that extends to all of it. It extends to talking about testing, about the disease, about vaccination. So I think I personally feel like people were open about the questions that they asked, and really nothing was too out of bounds for parents to ask about, which is great, because we were able to address a lot of things that people were hearing in the media about testing and vaccination and illness. So and we heard it all. I mean, we heard it all. We heard it all from the teenagers who had seen stuff on TikTok about being zombies after being vaccinated, to the parents who were talking about the metal chip inside the arm. I mean, all of it. We heard all of it. So I think we maybe heard more than other people would have heard from populations that didn't have that kind of relationship, a pre-existing relationship with the community. And so I think that's really defined what we have seen in our particular population these 2 years and a few months.
Oh, I got one follow-up question for you, Dr. Ochoa. How much strain is being put on your clinic as the pandemic enters its third year?
Well, that's an excellent question. I would say that the strain has been different throughout the course of the pandemic. I think the first months when people stayed at home and didn't get out, we, like a lot of other primary care clinics, had a big drop in the number of patients that were coming into the doors, and a big push to do telemedicine. As several of my pediatric friends around the state said, after a few months went by, we were working twice as hard to see half the number of patients. because we were seeing patients by calling them up, by FaceTime, by video, by any means necessary. But none of that was easy. I mean, none of the technology was out of the box, ready to go. People, Arkansas being a rural state, people don't have great broadband at home, so all that was hard. And then what we saw was really a big drop in the well visits that we were doing. And I think nationally it's been borne out that immunization rates in children went way down the first year of the pandemic because people were just not coming in and staying home. But as the pandemic dragged on, I think the toll on the healthcare workforce then became very obvious. We had colleagues of different disciplines that we knew in our clinic that got very sick, that got admitted to the hospital. We had one person who had been working in our clinic from time to time die early on in the pandemic. We had one of our office staff die from COVID-19. And so that over time, just the sheer number of people that were friends and family, aside from the patients that we were seeing on a daily basis that were also sick, really took its toll. And then it turned into a matter of who was able to work. So a lot of people stayed home in quarantine and isolation. And we've gone through several waves of being short-staffed and kind of having to make up for colleagues that can't work because of being ill or being exposed. Now at this point in the pandemic, we're kind of faced with maybe some improvement in that, but also the additional burden of trying to catch up, trying to get back and catch up all those kids that maybe didn't have a well visit for 1 or 2 years, maybe need some vaccines. And I think what the future holds for us in primary care pediatrics is that we're going to see big downstream impacts on the educational achievement of the kids during the pandemic. I think that we're going to be dealing with that for a long time. Mental health too, we all know about mental health, but I think the kids that got left behind in the educational system and that really were off the radar for a couple of years, we're going to be dealing with that for a long time.
Thank you. So, Dr. Romero, let me come back to you for another question. What are the gaps that you've seen in healthcare programs overall and services for the Hispanic Latino community?
You're on mute.
Thank you. One of the initial salient gaps was social services and food services for families that were impacted by COVID, that could not work or had a single breadwinner, a family that lost that income for that period of time. And what I saw was that those organizations that dealt with our Hispanic or Latino communities stepped up and worked to provide those services to the community. That was a big thing that I kept hearing about early on. Access to testing and access to vaccination, access to testing initially was an issue, and trying to get these tests in sites for Latinos to access. It's difficult for both testing and for vaccination, for example, for families that are hourly wage earners to leave for several hours to get tested or get vaccinated and then come back. And if they have, some of the mild to moderate side effects that fever or body aches that keep them out of work, they're losing time for that. So those are issues that were important for our community, for the Latinos in particular. And of course, always the issue of access to linguistically and clinically appropriate care. Being able to find out the questions, to answer your questions and to address them appropriately. I think one of the things that was in place when I came to work here at the health department, and I worked initially as a consultant in March, and then began working as the chief medical officer in April. But those individuals, including Dr. Tumlison and a number of individuals that were Spanish speakers, fluent Spanish speakers, had contacts with the press on a nearly daily basis, where we would speak to the press or have meetings with a print media to get this out, or the radio and television, which I continue to do and we continue to do. And I think that helped us get the message out there. The other thing that I think we learned early on was that Latinos rely not just on or really rather better said this way, Latinos do not really rely on radio, print press, and television for their news and for their information. It is social media. And social media is extremely important in getting our message out to them. It's also one of the reasons why Latinos are extremely impacted by disinformation or misinformation. You know, it's well known that is the biggest weakness in convincing individuals to get vaccinated. It is exactly what Dr. Ochoa was talking about, the chip turning into a zombie. You know, I have heard it all, and it's promulgated through these social media sites. So I think those were the major issues that we saw.
Thank you. Our next question is for you, Maricella. At the start of the pandemic coincided with implementation of the public charge rule. Can you explain what that is and how it impacted services during COVID? Before coming to Arkansas Advocacy, you worked at the City of Little Rock and helped them with the COVID outreach. And overall, in your outreach, what impact did immigration status have on people's openness to get tested or access to free services?
Thank you, Loretta. So first, I want to say the public charge rule has existed for many years in the United States in immigration, going back to the 1800s. Basically, what the public charge rule is, it says that we do not want people to immigrate and then become reliant on the federal or state government for benefits. So there's certain benefits that are impacted that people are not eligible for if they are immigrants, and then there are certain benefits that no matter what your status is, we have decided, for example, in the matter of public health, the emergency Medicaid is available to everybody no matter their status. What happened in 2020 was that President Trump in 2018 had introduced a change to the public charge rule. And it was really a complete change from this idea that we're trying to prevent somebody from using benefits in the future. And what they did was they tried to make it retroactive. And so that penalized people who used benefits they were eligible for and that they were legally able to get in the future when they were applying for their green card, or even if it was citizenship. It also potentially had the impact of making people deportable, which meant that people could have been placed in proceedings and have their green card revoked and been deported for benefits that they got that they were legally eligible to get at the time. And so this was really a big problem because many people didn't understand the nuances of the different parts of the changes of the rule. And this is a very complicated area of immigration law. Immigration law is often said to be on par with tax law. So this is a very specialized area. As a lawyer, I'm going to say what I'm talking about right now is not legal advice. I'm not anybody's attorney. I'm just giving general information. But if you have questions about how the public charge rule is going to affect your case or someone that you know, they should talk to an attorney because it is really complicated. So for example, people with visas are subject to the public charge rule. But if you have a U, a T, or a VAWA, those are all visa types for victims of crime, human trafficking, domestic violence, felony assault, very serious crimes. Those people are exempt. Asylees are exempt. Refugees are exempt. So it really depends on what type of case you have, whether or not this new change would apply to you, because they could not override the part of the law that was in place already. So basically, in general, the public charge rule says we don't want anyone who is primarily going to be dependent on the government for subsistence, right? So what did it prohibit before? It prohibited people from getting SSI, Social Security income, TANF, temporary assistance for needy families, which we also know as cash assistance or welfare. Medicaid, unless it's an emergency Medicaid, or again, in the case of pregnant mothers, all of that is exempt. But under the new policy, people could have been denied for getting Medicaid they were eligible for, even though at the time they were eligible. Now in the future, they would be permanently ineligible for their green card. They could have it revoked. And the problem became that this also applied to people who got benefits for their children. So US citizen children may be eligible for things like SNAP, supplemental nutritional assistance, right? Their parents, if they're undocumented or they have a visa or they have any other immigration status, are not eligible, but the benefits are for the children. And they only get, in Arkansas, they only get the benefits for the children. You could be denied on your future application for that, having received that benefit for your child. And there was a lot of fear mongering around this issue. And so at the beginning of the pandemic, when it happened, this rule went into effect literally in February of 2020. So in March, when everything shut down, and that's when the general public really learned about COVID, everybody was terrified, right? And if they had to get a test, Dr. Tomlinson and I spent many weeks with the media. I was on TV every single week as well for the city, talking about, first of all, emergency Medicaid is what covers COVID testing. So it was exempt, automatically exempt, right? But also in the first COVID relief bill, the CARES Act, they specifically said any treatment, any care, any services related to being hospitalized for COVID, that's going to be exempt. Like normally it wouldn't be, but we're not going to apply that, right? And so, but people were still afraid because for 2 years from 2018, they had been hearing that this was going to happen, and the consequences for your immigration case. And immigration is really hard. There are cases that last more than 20 years for lawful permanent residents. Okay, people have been waiting and waiting. And so people would say, I am not going to apply for SNAP for my kids. I need help with food. Where can I get food? But I'm not going to apply for SNAP for my kids because we have a case pending and I don't want it to be denied. And so my constant message was, it does not matter what might happen in the future with your immigration case, because we don't know what the law will be when your case is adjudicated. What matters right now is that your children have food and they're eligible for it, apply for it. But this was the sort of place that people were put in the immigrant community. And in particular, this was sort of this policy, along with some other things that they did. For example, the citizenship question that they wanted to include on the census, that also led to lack of participation in the census. But those kinds of policies that people were hearing about, you could not talk enough to override the fear that the community had. So I would not be surprised that hospitalizations in the community are low, because many people called me and said, I think I have COVID, but I'm afraid to go to the hospital because I don't want to be arrested by immigration. Because their understanding of how this was being implemented was that if you went and applied for a benefit, you would immediately be turned over to ICE. That's also not how it works. It works at the adjudication process, so at the application process. But that was the constant and continual messaging that they heard, and it was very hard to override that. And so I'm really glad to see, especially that the vaccinations in the community are high. That means that we've done really well, making them aware that this doesn't work. And the better point is that last year, all of the changes to this public charge rule that were made in 2020 were being challenged in court, and President Biden said he was not going to defend those anymore. And so it was going to the Supreme Court. The Supreme Court dismissed it. And yesterday, actually, the Department of Homeland Security released a new proposed rule It's more than 100 pages, so I haven't had time to read it. It's very tiny font as well. But it's basically going back to the original rule, which is we just don't want people to come here with the idea to get on benefits. But things that are clearly in the best interest of overall health, like vaccines, we're not gonna exclude you from getting that, because we want people to not have diseases, get sick, and end up in the hospital. We want pregnant women to have Medicaid so that they can go to the doctor while they're pregnant and their children can be born healthy, right? And so we're in a better place today than we were 2 years ago, but I think there's still a lot of misunderstanding about how that might impact them.
Thank you, Maricella. That was a great introduction, and a great talk about the public charge. And I've been looking at it for 3 years, and I think you explained it better than I've ever been able to understand it for myself before. So definitely thank you. Now on to Margarita Solozano. Margarita, I think I failed to introduce you at the beginning. So just to introduce Margarita, she is the Executive Director of the Hispanic Women's Organization of Arkansas. And now, Margarita, as a leader of a nonprofit organization in the community, you helped run testing sites early in the pandemic and then vaccine clinics later on. What did you hear from people accessing those services about their experiences?
First of all, thank you for including me in this conversation. And I noticed that pretty much every single of the participants have touched in some pieces of the things that we hear in our community. There is the misinformation, disinformation, plain lies about COVID, and the political climate that has prevented people from fully participating in a lot of these things, starting with the census, starting with access of services, how they can be safe when everything or the messages that we are receiving about our presence in this country may incommodate some of the people, because we don't speak the language, because we speak with accents, because our color is different. So that creates a lot of mistrust in what services can we access, how confident can we be approaching to request medical care or social services, because everything is intertwined in how we the people perceive they are going to be targeted for these services. Being in the community, I have heard so many different issues. Some of them have been already pointed out, but people, if they suspect that they have COVID, unless they were extremely ill, they will not go to the hospital. They will not approach the clinic because of fear. And also, once they were sick, certainly unable to work and unable to provide, even when I suggested people to reach out to the Human Services Department to request food stamps or to request other services, they didn't want to risk being losing or target to lose their status, or the possibility to have a status later on, because the public charge that Maricella mentioned. So it's a combination of issues that we have seen playing a role in how people approach or request services during this pandemic. It is very emotional. I've seen families suffering or going through all this situation. And as Dr. Thomason mentioned, unfortunately, we don't have too many deaths in the Latino community. However, the impact of those deaths is probably bigger than any other families, because maybe the person passing out were the breadwinners. and probably that person was the only person with legal status to work in the United States. So once that person is not there, the whole family, the effects on the whole family are so huge. The fear, the lack of resources, the lack of support system, and how you make them trust when the messages that we are hearing constantly are, you are not welcome here, that you don't count, you don't matter. So it is really difficult, and is convincing or working with people in that situation. It takes a lot of effort, a lot of emotional energy just to make sure that they connecting them with services that we trust will be there for them, and these services will not turn on them or having questions about immigration. So approaching those services, it was one of the issues that we saw constantly. What if I go and they ask me for my Social Security? Or we don't have health insurance. We don't have legal status. And also the cost, how much is gonna cost me? And I'm barely making it, or we just started building up our wealth in our community. I'm gonna lose my house, I'm gonna lose my car if I'm going to collections because of receiving services. So it is very complex. It is the same issues that the general community are going through. We have other issues on top because of the political climate that was created during the last administration that create that fear and that mistrust, not just in the government, but in the agencies that provide social assistance to people in the community. Pretty much everybody already pointed some of the aspects, and we are happy to see that the level of vaccination in the Latino community is higher than in other groups, but we may not have the clear picture because we don't know how many people are actually in the state. So we have a lot of work to do in the community, and we have to continue these collaborations and this sharing of information, because thanks to that, we have been pointing out issues that are important, and certainly working with the specific groups, not what are the fears, what are the issues that we see, and for the other agencies to tune their services to be more sensitive about the issues, about the situations, and the language that we communicate and how we communicate the messages, because it is not just to instill fear about get vaccinated or COVID is here, is how to communicate that to make it to ease the fears in the community. Language is important, and the way that we communicate either can ease the fears or increase the fears, but also making sure that that we have a language that is understood by everybody, and also that the message comes from different ways. It's not just the message, it's also the messenger. Dr. Romero mentioned about social media. With our community, it was important not just, we utilized the social media a lot, but at the beginning, we had to rely a lot on person-to-person phone calls, because social media for people 65 and over, 75 and over is not existing. People are not savvy enough to use the technology. And then whenever they were able to access those services, the issue of the language. All the initial efforts were in English. So for the Latino community, that was another barrier. So with us in that age rank, we made a lot of personal phone calls. We assisted people in setting up the appointments. We were connecting them with the services closer to their homes because they didn't have access to transportation. So it's a pile of issues that we have to address while trying to make sure that people trust the government. And I have probably difficult conversations with many people in the community, because for me it is important that the information comes to the community in a respectful and culturally appropriate way. And when those issues are not addressed, we are not doing our work. We are just making more promotionals, but not necessarily getting to the people. In social media, we have utilized Facebook, Twitter, Instagram, and things that I'm not familiar with because I'm not in that area of technology. But I know for us, getting the right message to the people is important. And getting the message also to the providers was important, because otherwise how we can really address the issues that we are facing if we are just encapsulating the issues within certain groups. And that is important. So the issues that Dr. Ochoa mentioned about the fears of people being having chips inserted to them, or it is a lot of also clarification. We cannot stop what the information runs on social media. So not just passing the message, but clarifying the messages, having the presence of Dr. Romero as a person who we trust that will give us reliable information. Him being next to the governor, day in and day out, reassuring that the vaccination has been going through the most strict levels of scrutiny to be safe for the community. That it gives some assurance of trust that we can continue, and we rely on or pass that message. And certainly having Dr. Romero being there is give us some peace of mind. And having the reports, Dr. Tomlinson telling us every day, keeping us informed every day how the things are going is important. For us in Northwest Arkansas, at least, we are fortunate that there was a lot of people collaborating, making sure that we coordinate activities, we pass information, and always telling people to stay safe. We don't have control over what every single person thinks or acts, but I think we have a good years of majority, because we were the results of having above average in the vaccination speaks volumes. And it's the work, not just one group, but it's the concerted efforts of several groups and entities from the social services, medical services. Everyone has piece to play in this effort. And hopefully we will beat the COVID soon.
Thank you. Now we have a couple of questions from the audience. VP Parker asked Dr. Tomlinson on slide number 6, the number of COVID-19 positive by age. Is this bar graph available showing same information for white Arkansans?
No, I'm sorry, I don't have a comparable slide for white or just for the population as a whole. I don't have it ready. I'm sure our friends epidemiologists help make this one. It's one he often shows at our Latino stakeholder group, and that's why I just borrowed it from. I don't have one for whites or for the population as a whole.
Thank you. Our next question is from Laura Latch, and she says, I work with adult English learners. Many of our Hispanic students have been afraid to get the vaccine because of misinformation. How can we ease the fears they have? And some undocumented students are also scared to go get vaccinations.
So I think it's really important that, like Margarita talked about, you have to move them towards the trusted resources, right? The people that they know in the community and they're going to believe. But also, you should be pointing them to the information about DACA students are eligible for the vaccine. Everyone is eligible for the vaccine. All of that information is available in English and Spanish on the Department of Health website. And any specific fears they have about their immigration status, they need to talk with an attorney about. But if it's specifically related to vaccinations or to COVID treatment or anything like that, all of that care is covered, provided they're vaccinated, because if you have health insurance now, some health insurers won't cover you if you're not vaccinated. But in general, if you have questions about your immigration status related to how something is going to work, you really need to talk to a lawyer.
Now for all,
Loretta,
I cannot.
oh, go ahead, Margarita.
I cannot. If the teacher wants to invite any one of us to do a presentation, we are open. It has to be via Zoom, but we can talk about several issues that are being touched here, but also the trust and the testimony of people who have gone through either the vaccine, the testing, or even people who have been affected and the impact, because if they are not vaccinated, they're still thinking that it's going to have other effects. They are putting not just themselves at risk, but putting their families at risk and probably leaving them without any resources for them.
Yeah, I mean, that's a good point. And I also wanted to go back to something that Margarita said. You know, it did make a big difference when Dr. Romero got up and said that it didn't matter what your immigration status was for your vaccine eligibility. That wasn't true in other states. I mean, I think in other states that word got out differently, and there was a negative impact on our communities. But it made a big difference for Dr. Romero to say that. And as Margarita says, it made a difference for us to tell people what our experience was with the vaccine and talk about our staff and other people. And from the day that we were able to give COVID vaccines in our clinic, I think last May, we were giving it to anybody. So I mean, I would tell families, everybody who wants to come, we'll give them a vaccine. I don't care if they live in your house or they don't live in your house, bring them all. You know, we'll vaccinate anybody because we believe in it. We think it's safe and effective. And that was more to get the community word out that it really was not just a good thing to do, not just a healthy thing to do, but that we were a safe place to get it done.
now the last question is for all of our panelists. As the pandemic continues, what can advocates, people who want to help do that would help Hispanic, Latino Arkansans during the public health emergency and beyond?
For this, I'm going to do it. We need to actually make sure that people able to vote. We need we need to address the issues at the legislative level, because laws matter. Who is representing us matter. And if we are always in fear, and there's always people thinking that the government is here to resolve every issue, we are wrong. We have to participate. We have to be active. Even we don't have to be at the Capitol every single time, but we need to do our part in our communities, making sure that our voice counts.
Anyone else?
Yeah, definitely. I would say one of the positive things of the pandemic is that I think Eddie can attest to this. We used to always get asked to be, there's only a few people that used to get asked to be speakers at things, right? About the Latino community. And we had to speak on everything about the Latino community. But what this pandemic did was bring together so many different people, and we continued to make that effort as a community. Margarita up in the Northwest and other groups in different parts of the state, to make sure that we were combating misinformation, to make sure we were getting good information out there, and the Department of Health itself. So the community now has a lot more people to turn to for information than before. And I think it's really important that past the pandemic going forward, that we make sure that we don't put that pressure only on a few people again, right? There are so many people involved in working with the immigrant community in Arkansas. And we really want to make sure that we keep that large spectrum so that people have access to resources in their own area instead of having to depend on only one or two people.
Thank you.
So I would add to that, going forward, really, it's incumbent and it's dependent upon the Latino community to move their healthcare forward. And in particular with regard to COVID, each of us that has received the vaccine, and I've made this statement, publicly on a national basis, that I would not accept a vaccine, I would not approve a vaccine that was not safe for Latinos and for all Americans, and I'd be the first to receive it. I think that those of us that have taken the vaccine and have gotten boosted should continue to be champions for the vaccine. Convince our neighbors, talk to our friends, dispel those unfounded rumors and disinformation. And if you hear it if they hear it from us, from us in our conversations, we will change minds. We're a community that influences very much by each other. And that's what I keep telling people, that those people that have tested or that have vaccinated themselves, they are ambassadors for that particular activity. So I think we need to do that as Latinos, and we need to educate our compadres, if you will, about this disease and its consequences and the way to prevent it. We influence each other very much.
Thank you, Dr. Romero. And with that being our last question and our last answer, we're at time for this forum to end. And we certainly appreciate all of those that have joined you. And please remember, we will have the transcript totally in Spanish with about the middle of March or so. So again, thank you very much.
Thank you.
May I do one last comment? Probably we are not making justice, because yes, all the social services are important, but here in Arkansas, employers also play a big role, the corporations, and they are requiring people to get vaccinated to protect themselves and to protect others. So I think it's important for us to mention, even though it has been challenged, but probably it is equally important that they also were active in promoting the vaccine and promoting safety among their workers.
Thank you. And with that, we'll say goodbye, and please be in touch if you're interested in joining the Kids Count Coalition.